Live with us right now is Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. And, Joe, thanks for joining us day after a holiday. A lot of families, you, me, heading to the beach at some point this summer. And I was talking to some folks over the weekend who said that they ran on the beach when they were on vacation, and they came back and they have some problems with this plantar fasciitis type of thing. And you said, oh, yeah, so I wanted to bring that up for people that are vacationing and to keep that in mind.
Yeah, I'm going to talk about vacationing today, and we're usually the ones that go to the beach as well. I'm going to talk about the other side of it. I've had a lot of people ask me to go into the mountains for vacation, and I'm going to talk about some medical issues, but definitely calf problems, Achilles problems, and plantar fasciitis. Many people, for years that we've seen in our clinic, the change in the surface of running on the beach can lead to an overload of those shock-absorbing tendons in the foot. Plantar fasciitis so common in adults, 25 to 30%, and so you go to a different surface and you can kick off plantar fasciitis. And if it's acute, it's easier to treat. If it gets to be chronic, it's a little bit more difficult. So if you come back from the beach and you have this stiffness and achiness, especially first thing in the morning after you've been running on the beach, get in and get it treated by your sports medicine or primary care professional. But, Ray, you know, the other side of the coin, I think you guys go to the beach too, so do we.
Yeah.
I've had questions this year, especially in the last month, 3 or 4 questions about people going to altitude. And there's a thing called altitude illness. And amazingly, in, I think, Ray, 22 years that I've been doing this show on WAKR, I've never talked about altitude illness, and it can be life-threatening. So it's called mountain sickness. And mountain sickness, I want to talk about a little bit today. I've had a lot of people saying they're going to run half marathons or they're hiking with their scout group. Just to get an idea, mountain sickness starts at about 5,000 feet above sea level. Denver's about 5,500 feet above sea level. The resorts in Colorado, Aspen and Vail, are about 8,000 feet above. Where all the scouts go to hike in New Mexico, Mount Baldy, where both of my sons went, 12,000 feet above sea level. Some people going out of the country to Peru, about 8 to 10,000 feet above sea level. And to give ultimate perspective, Mount Everest, 29,000 feet.
Wow.
That is number one. 4 things can happen when you exercise in altitude. Number one, from the basic and least, problematic, is your performance will drop off. Most runners say that it could be as much as 1 minute per mile. You just have to expect when you go to altitude that you're going to have a performance drop, and there's just no doubt about that. It takes about 3 to 5 days to acclimatize, and for the illness problems, get there early and get acclimatized like we talk about in the heat. Slow, gradual ascent over a couple of days can avoid things like number 2, the most common illness is called acute mountain sickness. People get headache, sick to their stomach, vomiting, trouble sleeping. I had one of our scout masters who was with my son in New Mexico that had acute mountain sickness. And you either have to descend or, if not, at least stop ascending. Sometimes treated with oxygen. There's a medicine called acetazolamine that can help for acute mountain sickness. Now, the other 2 are life-threatening, and number 3 is called high-altitude cerebral edema, and that is where there starts to get to be swelling in the brain, and people start out with an unsteady gait or decreasing consciousness, and they're lethargic and disoriented, and it can go on to coma or death, and it's a life-threatening problem. They know this in the mountains. They need to come and get you and bring you down from the mountain. It is rapid descent is the thing that you have to use to treat. We know it as HACE, high-altitude cerebral edema, and the other is HAPE, high-altitude pulmonary edema, where this fluid collects in the lungs, and people have significant cough and cyanosis and rapid breathing and respiratory distress. Get that person down off the mountain. So going to the mountains can be a little bit of a risk if you're going to go the other way from the beach where we like to go. And make sure that you prepare, you get there early, you acclimatize yourself, and it takes about 3 to 5 days to get acclimatized to some extent to altitude, to avoid these altitude illnesses.
Really good stuff, Joe. Thanks for jumping on, and good education as far as hiking and climbing and that type of thing. Good stuff. We'll catch up with you next week.
Have a great week, Ray.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live this morning.